YouTube, it's Tish. Welcome to my channel. Thank you for clicking on the video. Make sure that you hit that like button. Today is Sunday, February 27th, and let's talk the Diep Flap surgery. So I am 11 days post-op. It's 5 days home. I spent 5 days in the hospital. So let's see, I'm very grateful to have made it through that surgery. The surgery ended up being 13 hours, which is a little bit longer than what he expected. And I said that on one of these visits that I go talk to him, I want to just kind of understand for myself why it took 13 hours. Because he did mention a couple of times when he came to the room that there was like a hiccup, but everything went well, and I'm healing well. So I kind of want to know what that hiccup is. I haven't asked yet because my brain's been a little too foggy to just kind of be able to ask to understand and consume the information. So I haven't asked that question yet, but I will once I feel like I've gained greater clarity in my mind, so I can understand it for myself. Let's see. So I am with one drain. Let me see if I can stand up and show you. I can't use my arms to push myself up. I have to use my abdomen, but I am left with one drain. And it's coming actually from my hip. Because I do have a scar that goes from hip to hip. And when I originally was in the hospital, I had 6 drains. I had 2 coming from each breast and then 1 from each hip. And prior to me leaving, that Sunday, when they released me that Sunday, he took 2 of the drains out from my breast and left a drain in each breast and then a drain in each hip. Then when I went for my first post-op visit on Thursday of last week, he removed 3 of the drains, with the exception of 1. They had really low output numbers. The one that he left in had the highest output number, so he felt like the others could come out, and he left the 1 in. That output has been fairly it has decreased in what it was outputting when the other drains were in, but it's still a decent amount. It's about between 18 and 20 milliliters each time I drain it. So I drain it when I first get up, I strip it and drain it when I first get up, and then I strip it and drain it before I go to bed. So how do I feel? I'm grateful to be alive, but I am very sore. I'm not as sore as I was in the beginning. I would say that I've kind of gotten used to some of the soreness out these last couple of days, but the very first week or so, when he told me that you're gonna feel like you've been hit by a truck, an 18-wheeler, he wasn't lying. It was very painful, and it was more so painful for me in the abdomen area, from that hip to hip cut, and in the area that he took the fat from. So what I had was the Diep Flap surgery, where they took the tissue from my abdomen They took the tissue and fat and blood vessels from my abdomen and transferred it to reconstruct my breast. So, you see, I'm a little winded. That's a result of the surgery. So I do my exercise here. He has it set to where I needed to hit 15. I can do that now. I'm up to 2,000, and I try to do this a few times a day. This helps to build the oxygen going back to my lungs, and it also helps to prevent blood clotting. So I do that. But anyway, let's see, where was I? So for me, I had gotten used to the tissue expanders and that feeling, that the uncomfortableness that the tissue expanders have, to where this pain here, where the reconstruction of the breast, doesn't even really bother me. It's just like, okay, it's uncomfortable there. But the area where they rebuilt, let me try to scoot back and show you a little bit of the area where they rebuilt the belly button, and where they did the cut just down there, again, right at that bikini line. That's where most of my pain comes in at. What they do is they take the blood vessels from the abdomen area and transfer them to the breast area to make sure that you have good blood flow. So I have not had any type of issues thus far, and I'm so grateful for that. And I think that's, I can only attest that to the diligence of my plastic surgeon. Right after the surgery, I haven't had any issues with skin necrosis, tissue necrosis, because that's failure of the blood vessels, and that's when you'll experience that. And I will say that I spent 2 days in ICU, and that's so I could be closely watching. He was very vigilant about me being closely watched. That first night of the surgery, he had the nurses coming in to check the blood vessel flow and to make sure every 15 minutes the first night. So there was no sleep that first night at all, but I'm fine with that. And then during the course of that, towards that morning, once he came in, he changed it to every 30 minutes. And then during the course of the day, he changed it to an hour. But they were coming in every day with the scope. Well, every 30 minutes, every 15 minutes with the scope, listening to that blood flow, making sure that that blood flow was actually flowing in each breast. He has 2 areas of the breast that he goes in with that scope, and if he hears that whooshing sound, then those blood vessels are working as they should, and very diligent about that. When he moved me from ICU to a regular room, they had to do it every hour, and then towards the last 2 days, it was every 3 hours. But they had to come in and put that gel. It was almost like an ultrasound of the breast. Put that gel on there, listen for that blood circulation on both sides of the breast. Very diligent, and I will say that I would recommend anybody to him for your reconstruction care, because he is on top of it. He wants to see his patients heal properly the first time, and it's through his, I think it's his diligence and his dedication to his craft that he has been successful and that I've been successful under his care. But the pain, he told me it would be a lot of pain. But I only took the hydrocodone once while I was in the hospital. And it's because the nurses made me take it. When they were moving me out of the bed into the recliner chair, they said, you need to press this button because you're going to be in a lot of pain once you move out of this bed into this chair. This movement is about to be very painful to you. And I was like, no. And they were like, yep. And so I pressed it, and that was the one and only time I had taken the hydrocodone for pain. The entire time I was in the hospital, I did not have any pain medication. Because I don't like the way that that makes you feel. I mean, that night that I took that, I was seeing flurries and hearing stuff, and I just, absolutely not. I'd rather push through this pain or ask for some Tylenol or something before I take that. I don't like the way that makes me feel. So I didn't have any pain medication while I was in the hospital. What I did have medication was for nerve pain and for antibiotics. So they were giving me that round the clock, 3 times a day, the nerve pain, 2 times a day, the antibiotic. The other thing they were giving me was stool softener, because anesthesia tends to collapse your intestines. And so once your body is kind of back pumping and that blood is flowing back, it takes a while for those intestines to really get back moving. So they give you stool softener to, get things moving once they assign you a diet. So I was taking stool softener regularly. I take my nerve pain, and I still take my nerve pain 3 times a day. I still take my antibiotics twice a day, and that's what I was doing in the hospital. That first night, I had so much mucus built up that I could not breathe. It was just so much collecting in the back of my throat from having that tube down my throat and having the anesthesia, that it was just, and it was difficult to like bring up, because then you're putting that tension on your abdomen. So I was having a very difficult time breathing that first night. And they don't give you anything to eat or drink or even ice until the doctor comes in, once you've been settled and are awakened up in the room, and he clears that. Because I was about to tear somebody off the bone for some ice. And then finally she was like, Miss Betty, I got you some ice, so we're going to be BFFs, right? And I was like, we can be BFFs. You are my BFF if you can give me some ice. Because my mouth was so dry, my throat was so dry, my nasal cavity was so dry that it was difficult for me to breathe. And I think I was starting to have anxiety. So once she got me those ice chips, and I was really hesitant about taking them at first, because in my first surgery, I have a really bad reaction to anesthesia and I tend to throw up. But this time, what he did was have the anesthesiologist put like a patch behind my ear. And I wore it for 3-4 days, probably longer than that. But he didn't want me throwing up. He was like, I don't want any tension on your abdomen. So he gave me a patch. It's like for seasickness behind the ear. And I did not throw up once this surgery, even after taking the ice chips. So my first night, my meal, and it was night. It was like night, like 9, 10, 11 o'clock at night. Once everything was done. I think he ended about 9 o'clock that night, close to 10 o'clock. So I got my ice cleared to be given to me around 4, 5 o'clock that next morning. I think that's what I looked at the clock and saw when she brought me just a little bit of ice, just something to get to moisten my palate, because my mouth and my nasal and everything was just very, very dry. But it was so much mucus that I needed to spit up. Um, let's see, the following day, once he came in, he got me on a liquid clear diet. So I had things like chicken broth, beef broth, jello. I didn't want any of that. I just mainly had ice chips. Really, the hospital has some really good ice chips. So I did that. I did a little bit of the beef broth, a little bit of the chicken broth, a little bit, but your appetite is trash. Um, I would say the first few days, you just really don't have an appetite for food. At least I didn't. I'm just starting to get my appetite back, but I'm very cautious about it because with the different medications that I'm taking, I don't want to just introduce all these foods back into my diet, not knowing and understanding what type of reaction that it's going to have, especially with the stool softener. I'm not taking those anymore because I don't need them. But like with the nerve medication and the antibiotics, you just still have to be mindful of the type of things that you're eating. So my diet, I'm still trying to keep it very simple. If I do eat something like last night, I had some lasagna, and it was probably about that big, and that was it. Um, One of the things that he told me to take that I've been taking for the last since I've been home is this stuff called Juvent. It's for wound care and wound healing, and I'll insert a picture here. And what it does is it's a protein drink, and I actually have it here. I put it in here, 8 to 10 ounces of water mixed in with the protein powder, mixed in with that Juvent protein powder. And what it does is it helps to increase blood flow and oxygen to your tissue. And it's delivers the different types of nutrients that you need to the wounds. It promotes the building of proteins um, to support your healing. It builds tissue and collagen, and it gives you the micronutrients that you typically might be missing out because of any type of surgery that you have. So I'm going to be drinking this Juvent for 2 weeks, and I drink it twice a day, in the morning and in the evening. It's decent. It tastes like they have a fruit punch flavor, a lemon flavor, um, and an orange flavor. And the orange tastes like orange sickle. The fruit punch tastes like a fruit punch. The lemon tastes like yeah, but it's all tolerable. And in my follow up, he said everything was looking really good. Things were, you know, my scars were healing as they should. So that was one of the things that he told me, like prior to when we were, you know, getting prepared and getting ready for. He was like, I want you to start taking this Juvent. This we give this to our patients, and so be taking it for 2 weeks, twice a day. Promotes wound tissue rebuilding, healing, this process, because you know you really have on the outside it doesn't look as bad as it probably looks on the inside, so it's helpful for that. Spent 5 days in the hospital. Like I said, the entire time I was in the hospital, my diet, though he changed my diet like the last 2 days, he changed it to a regular diet. For some reason, they couldn't get that change didn't flow over to the cafeteria where they make your food. So they kept giving me a very light diet, which was fine with me. Like I said, didn't have an appetite for much of anything, and I was really concerned about getting sick. So I wasn't rushed to eat any of that stuff they had. So the chicken broth and the beef broth, and I think I had cream of wheat a couple of days for breakfast, Jello or something. I was fine with that. What I'm eating now, still very simple: oatmeal, cereal. I eat Cheerios, multigrain, so I eat a little some cereal. I have fruit. I like grapes, pineapples, strawberries, berries. So I eat small bowls of those. For lunch, I had a salad the other day from McAllister's that lasted me 2 days. Uh, for dinner, a friend of mine had some food sent over this week. So chicken, baked chicken, salmon, green beans, carrots. I think there's some broccoli, but I've been staying away from broccoli because I will say that you have a lot of gas with this surgery. Like when I was in the hospital, they were happy that I was gassing. They were like, yeah, this is exactly what we want to see. We want to hear you belching. We want to hear you passing gas, because that means that things are moving. Your intestines and everything is opening up, and the mucus is clearing up, because the mucus was very bad that whole week I was in the hospital. I was constantly hawking up phlegm and spit and just needing to just clear that. I spent a lot of time doing the exercises, and it was like after I would do this, I would feel more mucus coming up. But I slept in the chair, in the recliner chair. After the first night, I slept in my recliner chair in the hospital room, and I'm sleeping in a recliner chair now. I have found that to be easier in you getting up, because you shouldn't be pressing down with your hands to get up. You're going to have to kind of brace yourself and use those core abdomens to get up. Those ab muscles that have been basically cut into to get up. You can't, you should be keeping it here, a little bit here, but it should really be here. You shouldn't be pressing down. You shouldn't be pulling. You shouldn't be lifting, because that will disrupt and could possibly cause failure here in your flap. And you don't want that. You don't want to go through all of this only to have, blood vessel failure because you've pushed down or you've lifted something. You shouldn't be lifting anything over 2 pounds. But you do need to move around. I will say that. That is one of the things that he even emphasized to me Thursday on my visit. You need to move around. I don't want you just laying around doing nothing completely all day. I need you to move around. You can take a walk to the mailbox. You can take a walk to the neighbor's side of the house. But you need to move around throughout the course of the day to get that blood circulating, and just to get just to start healing from this process. A lot of people think of it, and a lot of people have basically treated it as, oh girl, you're going to go get you a tummy tuck. Oh, you absolutely not. Yes, it has the same actions as a tummy tuck. Yes, I did get fat removed, and it was transferred to my breast, but it was a totally different type of procedure. I didn't have fat sucked out and taken out. I had fat taken out, tissue taken out, muscles reconstructed, blood vessels, nerves transferred. That's not in your typical tummy tuck. I didn't get any fat transferred out or sucked out. Yeah, there's some type of binding that's here. And so he actually took that and reconstructed it and took those blood vessels. And so there's a lot of intricacies. So don't be cavalier in your healing process with this, and don't let others be either. Don't let them minimalize or minimize what you've been through, because you will find yourself not taking it as seriously as you should, and that's when you see flap failure. And that was something he even emphasized to me during our visits. He was like, look, a lot of people are going to tell you, oh yeah, this is, you know, your tummy tuck and you're getting a tummy tuck out of this. He was like, yeah, you're getting a tummy tuck out of this because you got to use the tummy to build the breast. And it's not your typical go in to the Dominican Republic and fly and get it and you flying out the same night. There's a reason I spent 2 days in the ICU and 3 days in a regular room for 5 days being a hospital visit. So don't minimize it, don't trivialize it, because then you'll trivialize your care and you'll minimize your care. And then next thing you know, you're going to have skin and tissue necrosis, and you're going to see your skin start to just disintegrate and smell, and you don't want that. You don't want that. So be very vigilant about the type of procedure that you have and treat your healing as such. And correct people who try and do it, or just ignore them. That's what I do. I just ignore them. Oh, okay, yeah, I sure did. That's what I got. What's next? There is a third surgery that's going to be further down, but I'm off until the second week of February. Second week of March. I think I go back to work March 14th, but I'm going to go back on a modified schedule until the end of the month. I'm not driving. I'm not driving right now. Hopefully on my next visit to see him on Thursday, he'll clear me to drive, because I will say this is hard for me, not just from a physical standpoint, but from just an emotional standpoint and a mental standpoint. This has been hard because when you've been raised to be so independent and then you've lived your life independently, it's hard to revert to be dependent. And especially when you feel like you have the strength, you have the ability to do some things on your own and you want to do them. It's hard having people come to your home and question how you run your household. So this has been hard for me. But it's just, like my therapist says, this is just a brief bump in the road, and things will be back as it should in due time. And so I just tell myself that. But the pain, I will say that it had the pain compared to the first surgery is greater than the first surgery. As you know, I was back to work after a week. Shouldn't have been, but I was. But ain't no way I'm even opening a computer or a cell phone until the 14th with this surgery. Might not do it then because my STD cleared me to the end of the month. And if I don't feel 100% like I have the mental clarity that I need, then I'm not going to do it, because I don't like approaching anything raggedy. And if I can't be my best when I go back to work, I'm not going to go back to work. So I'm really praying about that decision. I spend most of my days just kind of trying to rest. I listen to shows that I've been saving for this. So I have my Netflix shows, my Amazon Prime shows, some other shows that I had saved up in my AT&T DirecTV that I've been just kind of watching and listening to. That's what helps me sleep. But the pain, I take the pain medication to help me, to help myself. But I'm not in so much pain to where, I need some pain medication. This hurts so bad. I need some pain medication. No, I take the pain, the Tylenol, extra strength. That's what I take for pain. I take the Tylenol, extra strength, and the nerve pain, because you do have these shooting pains across this area, especially in that abdomen area. For the past couple of days, I've been having a lot of shooting pains near that drain site and where the other drain site was, and that's just the nerve pain. And so I do take my nerve pain. But again, I take it to be able to be independent and be able to pull myself up to go to the restroom or to walk around without being solely dependent on waiting on someone to come and help me do it. You will need help those first, I would say, 7 days of someone to kind of help you stand up. The problem is people will help you get up, could potentially help you get up wrong in a way that could help damage the flap. So you can't have people pulling your arms. That's the same thing as pulling you. So they have to be very mindful of that. They're just more so pushing you up, and it really should be from the back, that they're pushing you up more so than pulling you, because you don't want to pull and you don't want to try to rest on them, because again, you're putting strain on the flap that you don't want to have on the flap. So I take my pain medication to be able to push through some of that, so I could just do it on my own, because if you don't have somebody that is going to your doctor's visits with you regularly leading up to this surgery to hear and to see how you should be maneuvering, which I didn't. I went to all my visits by myself, so it's very difficult to explain to somebody who wasn't there to see the type of care that they should be giving you. So I'm just trying to push past, and he wants me to do a lot of it now on my own. Just take it easy so I can start using these muscles. I have to use these muscles, and it's gonna hurt, it's painful, but he wants me to use these muscles on my own so I can get stronger, so I can heal better. So that's it. That's the Diep Flap surgery. Like I said, I'm now a week and a half post-op, and I'm feeling all right. I'm feeling all right. I don't look all right. Oh well. I don't look my best, I should say, but oh well. You understand. But I got a t-shirt on today. Some would say it's tight. It's not tight. It has stretch to it, but I wanted to start being able to maneuver things on myself. I didn't want to just always wear something that was buttoned up or something that was really loose. I got to start getting movement around in this area too. I don't want to keep that real stiff, so I was like, let me see if one of these t-shirts can help me to really work some muscles that I felt like I haven't worked in a couple of weeks, especially in my back, and it did help that. It helped that completely. So that is it. A little bit of a longer video, but I hope that this is helpful to you. I will follow up once I've had this other drain removed. I'm thinking about moving my sleeping area sooner than the one drain moving. I said I wasn't going to do it until I got all the drains out, but it's hard for me to sleep in the area that I'm sleeping, because I'm sleeping in the living room and it's lights and it's activity, and I'm thinking about moving to my game room, but I'll see. But anyway, don't forget to like that like button. Hit it. Share this video. There is a share button down there in that box. Share this video with a friend, family member, anyone that would find this video useful, and comment if you have any questions that you have that about any of the information that I shared, how, whatever. Ask me down in the comment section, and I have no problem answering. And I will talk to you next time. I am editing a hair video that I did prior to the surgery that I didn't get a chance to finish editing, but I'm trying to sit up more. You see, I'm in my shed, I'm in my studio, so I'm trying to sit up a little more in preparation of going back to work. So I'm gonna go ahead and try and get that edited and put out also. But this video, talk to you soon. Bye.